This student activity for the next 2 pages is intended to be done by students after having gone through one example. So go ahead and give it a try before watching this video, and just come through the video in order to check your answers, or if you are stuck on something, in order to get yourself moving again. In just a moment, I'll start to fill out the whole thing. So in this example, we're looking at a clinical trial, and note we have to pay close attention to what the null and alternative hypotheses are. The null hypothesis is that there's no difference in safety, meaning that the drug is generally believed to be safe, and it will get FDA approval in this case. And the alternative hypothesis is that the new drug is less safe than the placebo. So as we go through these questions, we have to reflect back to what our hypotheses mean. If a drug is determined to be unsafe, then that means that we have found evidence for the alternative hypothesis, which also means that we reject the null hypothesis. If the drug is determined to be unsafe, but it is in fact safe, then we have an error. So this describes an error as safe drug that does not get FDA approval because it is believed to be unsafe. That's where we have rejected the null hypothesis, and therefore this must be an error of type 1. Now, if we look at the other side of things, this time we have a drug that is assumed to be safe. So if we're assuming the drug is safe, again, let's look back at our hypotheses. That means that we're going with the null hypothesis. At least we are failing to reject the null hypothesis. So if our drug, again, we're describing an error next, a drug that gets FDA approval because it is wrongly assumed to be safe. If we're assuming it's safe, we fail to reject, and therefore wrongly assuming it's safe must be a type 2 error, the type of error that would go along with fail to reject. Remember to look back at the table that we saw on the first page of these notes for determining how a type 1 and a type 2 error are defined. Alright, so now that we've described what a type 1 error is and what a type 2 error is in context, so here's our type 1 error and here's our type 2 error, we can look at these statements of what our priorities are. Suppose the highest priority is to ensure that the drug does not get FDA approval if it is unsafe. We want to think about, are we trying to avoid a type 1 error or a type 2 error? Well, what we want to see is that we don't have a drug that's wrongly assumed to be safe, and therefore this would be a type 2 that we are trying to avoid. To avoid a type 2 error, we want it to be easier to reject the null hypothesis, and therefore we want a large value of alpha. It's always a large value of alpha to avoid a type 2 error, and a small value of alpha to avoid a type 1 error. Now, of course, we could figure out the other one by process of elimination, but we don't want to do that. We really want to think about it and get more practice thinking about these questions. So here we have a change of priority. We say, well, now let's suppose you might assume that it's always our highest priority to make sure we don't approve a drug that's unsafe. But if the drug happens to treat an aggressive cancer for terminally ill patients, maybe the safety of the drug isn't as important as it would be if it were treating somebody who does not have a terminal illness, who really having an unsafe drug come into their system might actually affect their quality of life or their length of life. So let's just suppose that it's for an aggressive cancer, terminally ill patients, and that really the highest priority is to try and get that drug on the market and get that FDA approval unless we have really compelling evidence that the drug is unsafe. This is where we want to avoid a type 1 error in which the drug doesn't get FDA approval because it's believed to be unsafe. If we want to avoid a type 1 error, we need to make it harder to reject the null hypothesis, and therefore we want our alpha to be small. Going into our next example, it feels a little bit different when we compare our priorities, because the previous example, the null hypothesis was that the drug is not safe. That the drug is safe. Here the null hypothesis is that the drug is not effective, or in this case hand sanitizer is not effective at preventing the spread of illness. When we say not effective here, we just mean not providing any additional benefit beyond simply washing hands. And our alternative hypothesis is that hand sanitizer is effective at preventing the spread of illness. The reason we might care about how effective it is that widespread use of hand sanitizer does contribute to the growth of alcohol-resistant bacteria, right? The more that you use a certain germicide, the more resistance you'll see building up. And so if we're using this hand sanitizer and it's not helping, then all we're doing is getting more and more bacteria that are resistant to it. We want to make sure it's really providing a benefit if we keep using it in the quantity that we're currently using it. So, again, referring to the hypotheses for the questions of whether we reject or fail to reject, and then referring to our formal statistical decision to decide whether we're describing a type 1 or a type 2 error. If hand sanitizer is not found to be effective, then that sounds like it is describing the null hypothesis. So this is failure to reject the null hypothesis. And if we were to think that hand sanitizer is not effective, right? So we say because it's not believed to be beneficial or it's not believed to be effective, and we were to remove hand sanitizer from doctors' offices when in fact it is beneficial, that's where we have our explanation of what the error is. What type of error would that be? That goes with the fail to reject that we just determined, and therefore this would have to be a type 2 error. The only type of error you can possibly have if you fail to reject is type 2. All right, looking at the other side of things, if it's determined that hand sanitizer is effective, then that means that we are going with the alternative hypothesis. The alternative hypothesis is rejecting the null hypothesis. So to keep hand sanitizer in doctors' offices because it's believed to be effective, so is effective, is believed to be effective, those are consistent, so those are both describing reject the null hypothesis. That would be a type 1 error, because that would be rejecting the null hypothesis when in fact the null hypothesis is true in that the hand sanitizer is in fact not more effective. Okay, so again, here we have our type 2 error described, and we have our type 1 error described. We're going to refer to those when we go into the question of whether alpha, our significance level, should be large or small. If the highest priority is to avoid growth of resistant bacteria from excessive use of hand sanitizer. That means we want to avoid a type 1 error where we believe it's effective when in fact it's not, right? We want to make sure we don't, or make fairly certain that we don't. We're trying to avoid a type 1 error in this case, as we just described it above. To avoid a type 1 error, we want to make it more difficult to reject, and therefore we always go with a smaller alpha if we want to make it more difficult to reject the null hypothesis. Now here we have our flip side and say, well, it's not always our highest priority to make sure that we're not encouraging the growth of resistant bacteria. Maybe there's a deadly flu circulating, and even if we're not sure the hand sanitizer helps, right now we want to make sure that we use it unless we have really good reason to believe that it doesn't help. This is where we want to avoid a type 2 error. A type 2 error is where we removed the hand sanitizer from doctors' offices even though it was helping. So here, type 2, and to avoid a type 2 error, we always want to make alpha large, which makes it easier to reject the null hypothesis